Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're focusing on a common yet often misunderstood skin condition, rosacea. It affects millions worldwide, causing redness, visible blood vessels, and sometimes acne like bumps on the face. While it's not dangerous, it can have a major impact on self confidence and quality of life. To help us understand what causes it, how it's treated, and where the new therapies are headed, I'm joined by my friend and colleague, Dr. Bryn Henderson, a board certified physician and pioneer in regenerative medicine. Dr. Henderson, thank you for being here.
Well, and thank you for having me.
What is rosacea?
Rosacea is a chronic skin condition that mainly affects the face. It often shows up as persistent redness, visible small blood vessels, and sometimes bumps or pimples that can resemble acne. It can also cause eye irritation in some cases, and the exact cause isn't known, but we know it's linked to inflammation, changes in skin blood vessels, and the overreaction to certain triggers.
Does genetics play a role?
Yes, absolutely. Rosacea runs in families. Certain inherited traits may make somewhat more susceptible to develop it, especially if they have fair skin or a history of flushing easily. These traits can influence how the skin's immune system responds, making blood vessels more reactive and prone to inflammation.
And what about early development in the womb?
It can have a major effect. The structure of the skin and its network of blood vessels is determined during early formation in the womb. Differences in how these systems develop can make someone more likely to experience the redness and inflammation that define rosacea.
All right, how does rosacea usually present?
Common signs include flushing or persistent redness in the central face, visible blood vessels, and small little bumps that may contain pus. In the ocular rosacea, the eyes become red, irritated, and sensitive to light. Symptoms tend to flare and then improve in cycles.
How do you diagnose it?
There's no specific test for rosacea. It's easily seen sometimes on a patient's face, but the diagnosis is based on clinical exam and symptom history. The key is to rule out other conditions that can mimic it, like acne, lupus, or allergic skin conditions.
All right, let's talk about standard of care treatment. What are the main options available for our listeners?
For mild cases, topical treatments like azelaic acid or ivermectin cream can reduce redness and bumps. Oral antibiotics like doxycycline can be used for more severe inflammation, and laser or light therapy can even target blood vessels. By managing the triggers like sun exposure and spicy foods, alcohol and extreme temperatures, just as important as the medication.
Let's talk about traditional Chinese medicine. What do they do for it?
Well, in traditional Chinese medicine, rosacea is often associated with patterns like heat in the lungs and stomach, or the blood stasis, sluggish blood. Herbal formulas aim to heal with heat and inflammation reduction, while acupuncture points are used to improve circulation and calm the skin. Traditional Chinese medicine can be very supportive alongside conventional therapy.
Well, I want to know about regenerative medicine because that's what's coming to every doctor's office in the land.
That is true. And one of the things it does is it uses exosomes. They're studied for their ability to not only calm inflammation and improve microcirculation, but it supports skin repair and often triggers the body to make new cells. Some peptides therapies are already investigated and, in fact, are used to replace antibiotics at the present time, LL37, for example. They help reduce the redness and strength of the skin barrier.
All right, so what can they do at home to help manage it?
Good question. They should use gentle, fragrance-free cleansers and moisturizers. Wear sunscreen so that you decrease UV exposure that triggers flares. Identify and avoid personal triggers by keeping a symptom diary. Protect your skin from the extremes of hot and cold.
So what can people that have rosacea expect?
Well, rosacea cannot be cured, but it sure can be controlled. And if you use the right therapies, most patients can see significant improvement and far fewer flares within days.
What's your mnemonic for rosacea care?
It's CALM, C-A-L-M.
C stands for?
Control the inflammation with the prescribed therapies.
A.
Avoid known triggers.
L.
Laser or light therapy for visible vessels.
M.
Moisture and protect skin daily.
Well, I want to thank you, Dr. Henderson, for giving us these facts on rosacea. It's a condition that can be frustrating, but with medical care, trigger management, and emerging therapies, clearer and calmer skin is possible. If you or someone you know is dealing with rosacea, remember, you're not alone, and there are effective treatments to help you. Well, thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.